Thank you, Dr. Satyamurthy. Now we have the best for the last. Dr. Deepti Joshi will be speaking on the communication skill training for the postgraduates. I think, as I told you in the beginning, there's no curriculum for good communication. But having said that, there are certain time-tested lessons for the youngsters, postgraduates, how to communicate and how not to get into trouble and how to be good at your practice. Over to you, Dr. Deepti.
Thank you, sir. At the outset, I would like to thank Krishna Prasad, sir, for this wonderful opportunity. So why communication pearls for postgraduates is important? Basically because it's not a part of curriculum in many states yet. And the major foundation between a doctor-patient relationship happens only because of the communication which happens between the doctor as well as the patient. And that is the first step how the patient actually judges it. Even if you give a bit of altered treatment, but yet if you have made the patient happy by the communication way, the patient will still come back to you for a second consultation, maybe for the same problem. But if our speech is not good, our delivery is not good with respect to our facial expressions, this patient is never going to come back even if you give the exact results to him. Communication doesn't mean just oral skills, it means the body language, the facial expression. It is a huge part of the science which is being put together. So when you come to the communication per se for the postgraduates, for the senior or the junior residents, there are 10 yes, which I would like to say. The first one is be calm and confident as in when the patient enters the room. The next point, a good greeting. A good handshake when the patient enters makes the patient feel that he is being wanted in the room. It may not be as firm as when you meet your friend or your close colleague, but then still a small amount of handshake would do a good wonder. Smile often, but look at the position of the patient or the condition of the patient before smiling. An end of patient and you keep repeatedly smiling may not suit the scenario, but then don't keep, and second point, don't keep smiling continuously, but I think a small break and then giving a small smile makes the patient being wanted in the room in which he is being present then. Address with the first or the last name of the patient. When I did my MBBS, I did it in a government medical college in Bangalore, and we used to address most of the patients as Ajja and Ajji, that is Dada, Dadi. But then when I went to a private medical college for my MS, I realized that none of them liked us addressing them as Ajja and Ajji, despite them being Dada and Dadi. So that is what makes, they did not like them to be addressed by their age. So it makes a very lasting impression when you address the patient either by their first or the last name. And the most important point would be if you add a Mr., a Miss, a suffix of Mrs. makes a very big impression, and keep explaining the same, you keep using the name, okay, Mr. So-and-so. So it really makes them feel closer to you when you take their name and address them by their name. And always sit down. When I was searching for the post, as a whole, when the communication of the doctor's part I was searching, I found this very small research where they have compared the happiness of the doctor in a scenario where patient is standing when examining or when taking a history from the patient versus a doctor is sitting when taking a history from the patient. They have noticed that in the same amount of the time when a doctor has been sitting down during the patient's examination, the patient felt that he has spent a more time in this OPD as compared to when the doctor was standing or leaning over the patient and asking him, oh, acha, kya hua? So the patient felt the doctor is in a hurry, he wants to leave, and that was an attitude which was considered as a negative with respect to that communication research journal which was published. Give an opportunity to your patient to speak.
नाक में बहुत दर्द होता है यार, इधर रखिए, बहुत रखिए, मैं देखती हूँ, पेन बहुत रहता है, खुजली बहुत करने, हाँ रखिए, बस हुआ, पीछे जाइए, आप बाहर बैठिए, सर एक बार देख लेते हैं, हाँ 10 मिनट बाहर बैठिए, उसके बाद सर देखते हैं.
So if speaking is silver, listening is gold. We all know that the senior resident, junior resident, or the postgraduates may not be treating the patient, and finally the patient will go to the senior consultant for the management. It's basically the history and the clinical findings which they are supposed to write before passing the case on to us. But yet, it's very important to inculcate this habit of listening in our postgraduates, because this is when the patient, most of the patients do come to us to just explain their feelings, to just explain themselves of their problem. It may be a minor headache, minor itching, but to just explain their problem, to be felt, to be heard, which is not happening in their home, is what is happening in our OPD most of the time. So listening gives listening makes an important skill from the communication point of view. The next point would be eye contact. Don't freakingly keep looking at the patient continuously, yet to some extent a good eye contact which is broken sometime. So you need not keep staring at him without blinking, but then every now and then looking at him makes him really feel that you are listening to what he is talking. Hand gestures makes him feel that he is being wanted in the room. Lean a bit towards him makes him feel that he is again being wanted in the room. So body language, facial expressions, hand expressions plays a very important role when we are communicating with the patients. It's not just our oral part which plays a role. Ask open-ended question. So what do we mean here? There are two types of question: closed question, open question. So a patient comes to you with a redness. Acha, aapko redness hai? And patient says, हाँ. Now what did we do? This was a closed question. But if you tell them, tell me something about your redness. Since when have you been having this? And patient says 2 sentences. These 2 sentences may hardly take 10 seconds extra of that, but these 2 sentences are going to make a positive impact for the patient in your OPD. So what, why, how, when, all of these should be inculcated in your questions. Avoid yes or no answer questions in the OPD, which become the close-ended question. Restrict medical jargons. Postgraduates, senior residents and junior residents. We understand you have just passed your exams. You know a lot more theory than even I think consultants who have been practicing in special niche OPD for all these years. Yet explaining a patient that you have got a Duane's retraction syndrome type 1 with an upshoot and downshoot makes a lot of haywire creates a lot of chaos in the patient, rather than telling कि आंख का एक नस बचपन से थोड़ा सा वीक है जिसके वजह से आपका आंख बाहर नहीं जा रहा है, अंदर रहने के वजह से आपका सर टेढ़ा है. I think some part, maybe he wouldn't have understood 100% of what we are speaking, but at least he understood that some part of the nus is weak and that is why my eyes are tilted out, so let me undergo a squint surgery to make the nus or the eye straighter. So using less of medical jargons becomes important. And finally, end your talk or your session as positively as possible. So we may know a 90% of glaucomatous optic atrophy may not get back much vision. आंख चला गया है, नस मर गया है. Rather than this, 90% नस वीक है, लेकिन अभी भी 10% बचा हुआ है. हम पूरा कोशिश करेंगे इसको बचाने का. So we are not promising the patient that yes, this 10% will remain throughout your life. No, but we are telling that हम कोशिश करेंगे इसको बचा के रखने का, आपकी भी help की ज़रूरत पड़ेगी. So maybe this positive point which we are ending our talk with the patient will make him have a hope कि शायद ये बचाने की कोशिश करेगी. He will come back to you for that and he may refer few more patients to you. So ending with the positive notes becomes very important. Finally, there are 10 yes, but then there are 3 no's also for all the residents who have been starting. The first point, which has already been told by ma'am.
No, not that photo on the Facebook or Instagram, please. Not that. Please crop me if you're putting that photo or edit something, do something, put some beauty face, do something. Okay, I'll get back to you in some time and I'll send you one more photo which you can put. चश्मा निकाल ली? क्या हुआ?
आंखों से पानी जा रहा है डॉक्टर को.
इधर आना एक बार. ये सब कब से हो रहा है?
10 दिन हो गए डॉक्टर.
हाँ ठीक है. कुछ दवाइयाँ ले रहे क्या?
नहीं कुछ नहीं डॉक्टर.
Hello? Yeah, I've sent the photo which you should upload. Please upload that photo, not this one.
The
and
patient's
tag me
face
also.
explains
and
it
do
all.
some nice editing work, please. 1 minute, I'll get back to you.
So, digital era, we all are hooked to our mobiles, we are hooked to our laptops. So many times there are certain conditions, we do Google it up before we reach the diagnosis of the patient. And nowadays in the current era where you can just click it and search what is this condition, this has been applied so many times in the OPD. But it would be better not to use your mobiles or laptops or computers in front of the patients as much as possible. Even if there is an urgent necessity to use it, we may excuse ourselves from the patient, walk out for few times, or maybe do some procedure on the patient, make him wait for some time, and then you can Google out the diagnosis, put together, and then come to the treatment part of it. But avoid digital usage as much as possible in front of the patient. The next one would be to avoid slang words.
यार वो shit drop हो गया. अपेक्षा ये drop हो गया यार.
क्या न्यूक्लियस में?
हाँ 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 क्या करूँ अभी, क्या करना है?
बोला था ना तुझे छोटा रेक्सिस नहीं करने को, हो गया ना अभी कॉम्प्लिकेशन। अभी क्या करेंगे? रुक मैं वॉश होके आती हूँ फिर देख। ओके
Agreed, the eyes are closed, but then the patient's ears are wide open. And he has heard all the words which are responsible for his panic. Shit, drop ho gaya, bola tha nahi karne ko. So even if you make perfectly fine, even if the retina consultant removes out the nucleus, even if you place a perfect sulcus IOL and the patient ends back getting a 6966, but the patient will know that we have done something wrong inside the OT. So do as much the communication is important in the OPD. Communication is very important in the OT also, where the patient's other senses are more active because the eyes are being covered up. So mind what you speak, a hand gestures, not panicking, not using certain words, not using slang language becomes very important. And the last and the final one, never trivialize any problem. A minor headache which had been referred from many places reached us, and finally just because the patient told me, 5 doctor के पास जाके आए हैं कुछ अलग करो, and I did an MRI in the child and it turned out to be something grave, intracranial tumor. So it could be a small thing for us, but it is a major thing for the patient. So never trivialize any problem. A small redness could be a heralding sign of something underlying thing. So take care of each and every problem of the patient when he presents to you. So with this, I would like to say that this is a small quote, but it plays a very important role in our communication journey. People will forget what you said, people will forget what you did, but people will never forget how you made them feel, and I think we make them feel better in all the way, maybe our hand gestures, our facial gestures, body language, ocular signs, as well as our clinical skill. So clinical skill comes in the end, and all of these comes way before that, before we start examining the patient. So with this, a happy communication to all of you, and thank you KP sir once again for this wonderful opportunity.